It's an issue that maybe some of the seats that are empty is because the issue is being played out in the General Assembly just down the road. But it's an issue you feel prominently about to come in here and talk about it. And it's also an issue that we've had teed up twice over the course of the other 49. It was led off by the massacre at Virginia Tech in 2007. And that was such a conversation that didn't end. We said we're going to continue it. And I will tell you, the follow-up conversation on June 5th, 2007, mental health, a personal issue with public consequences, was among our best conversations. So when we were reflecting on what are the issues of importance, given what was happening at the General Assembly, given what's happened with another tragedy touching off of the major concern, we thought this would be important to put back into the room. I'm joined today by my colleague, Michael Martz, who, if you know this issue, have seen his byline quite a lot. What we've done with all the previous public squares is take advantage of this outstanding talent we have in our newsroom to help us tee up the issue, to kind of explain where it is and where it's going. There's a nice wrap-up in Sunday's paper that told you where the issue was, where it is now, where it might be headed. We thought that Michael, from his unusual perch of covering this issue, might be able to give us up to date what's going on. Michael, welcome.
Thanks. My job is a little hard to describe. I don't exactly know what my beat is. I basically cover state and local government and public policy issues. Over the years, I've done a fair amount of investigative journalism, and one of the topics that I've spent a lot of time on, especially about 15 years ago, was the mental health system. And a lot of the same issues that we wrote about then as being problematic are still problematic. I remember we started on writing about people in adult homes in this city and around the region, and discovered that many of them were people who had mental illness, and they, yesterday there was a bill killed that would have made it possible to use your auxiliary grant, state and local money, for supportive housing, and so that everything I wrote about in 1997, 98, 99 is still a relevant concern. It's been, I found myself back on this particular topic for a very sad reason. Many of you, I'm sure, know about what happened with Senator Creed and his son Gus on November 18th and 19th. I use both days because they're both quite relevant. On November 18th, Gus was taken into an emergency custody order in Bath County and to the hospital, small hospital in Hot Springs, for a mental health evaluation to see if he met the criteria for a temporary detention order. And the criteria is basically posing a threat to yourself or to others, or being unable to care for yourself. And in the process of that's a 6-hour limit. That's actually 4 hours, and then they had to run over to Warm Springs to the magistrate to get a 2-hour extension. And so the details are still fairly protected because of health privacy, but he appears to have met the criteria in some fashion or another for a TDO. And the process then becomes, you can't issue the TDO, which allows for further evaluation up to 48 hours, unless you have a receiving facility, a psychiatric facility that can, where the person can go, a therapeutic setting for further evaluation. For whatever reason, no such facility in bed was found for Gus Deeds. So there's some question about whether the Community Services Board called all of the hospitals in the region that could have. Some hospitals said later they had beds but were not contacted. There's a question about why they didn't contact the state hospital, mental hospital in Stanton. There are a lot of issues surrounding this incident that remain unknown. But what we do know is that Gus Deed was released about 6:30 p.m. on November 18th, and at about 7:30 the next morning, he attacked his father outside of their home in Millborough, stabbed him a number of times in the front of the head and the chest, and then went back in the house. His father staggered off to the road for help, and Gus Deeds found a .22 caliber rifle, and apparently there was not supposed to be ammunition, but he found at least one bullet, so he killed himself 13 hours after being released. So that really, and we broke that story that next morning, and the debate hasn't stopped since then. We'll find out more about what happened when the Office of the State Inspector General releases the results of its investigation. So far, the state has declined to release, the Mental Health Department has not released its results because they're citing privacy concerns. And so we don't really know all of the details of what happened. There's been a lot of finger pointing, a lot of questioning, but I think we will find out. But what we do know is that this was not an issue that state officials and local mental health officials or regional mental health officials were unaware of. The Inspector General 2 years earlier had issued a report on a phenomenon that's sometimes called streeting, where it's a small percentage, but you have people who've been found to be a threat to themselves or others for whatever reason, usually lack of a psychiatric bed, or released, or given the less intensive level of care, not an appropriate level of care to which they're entitled. And he raised the concerns then, and there's some evidence that some of those concerns and recommendations were not heeded. So here we are again. So now we're at the General Assembly, where Senator Deeds has quite bravely stepped into the arena. He bears the physical scars of what happened, as well as the psychic scars. And there are quite a few other people introducing legislation, and now there's attention being paid to it. What will happen remains to be seen. I want to cover 3 quick areas, and then I'll move on. But the main focus has been on legislation to change the crisis response system so they could extend the amount of time an emergency custody order could remain in force, which allows people to be held against their will, actually, and which is a big issue. It's a very big issue, and we have some people here who can speak to it. The recommendations of the legislation range from an extra 2 hours to an extra to full 24 hours, or the governor's task force that was formed after this incident has recommended 12 hours with a protocol for following it. They're going to create a psychiatric bed registry so that in the beginning of the process, people can go online, the emergency workers, clinicians, and see what is generally available. They still have to make the calls to the hospitals to make sure that they can accept that particular person, but any amount of time you can save in the front end of the process would be welcome. This was supposed to have been instituted years ago. In fact, most state officials thought it had been done in 2012, and until we found out after this happened, realized that it had never gotten done. So now they're going to mandate it in state law. And the other piece is that the legislation is going to address is that the state mental hospital and the State Department of Behavioral Health and Developmental Services now is going to have, if this legislation passes, a legal obligation to step in, assist the Community Service Board in trying to find a community bed, a community hospital, and if not, they'll have to take that person, accept that person as under a TDO at one of the state hospitals. There are 9 of them in Virginia. So, and requiring a great deal more coordination than was evidenced in the Deeds situation, as best we can tell. And that kind of gets me to the next point, which is the system, and again, I'd be interested to hear what you have to say about it, but the system is not one thing. It's a series of things that don't fit. It's like a puzzle that the edges don't fit together. You have 40 community services boards. Some are regional or behavioral health authority here in the city. They're responsible for providing emergency services. They're responsible for providing case management, they're accountable to the state. But the question is, how accountable? And then you have law enforcement plays a major role in taking people into custody and holding them for hours and hours while these evaluations are done, and then if they're TDO, taking them to the facility where they're going to be held for further evaluation. So law enforcement has a big stake in this. Plus, we've discovered that we've deinstitutionalized to a large degree and downsized the state hospitals, but now the largest residential provider residential housing for people with mental illness have become our jails, and they're simply not equipped to handle that. That's another Inspector General's report, which is shining a light on that. And the community services boards sometimes they work well together with jails and provide services. Sometimes they don't. So that leads me to the broader issue of where do we go from here? Beyond the legislation that's pending in each house, where do we go from here? The governor's task force that Governor McDonald appointed and that Governor McAuliffe has reappointed, they're diligently working through a lot of different issues, but mostly around the crisis response and also community services so that you can avoid going to crisis. The lack of capacity across the state and the lack of equity, really, depends on where you live. I mean, Tree Deeds said, Bath and Highland County, you're at the end of the line in terms of getting service. So that task force is tackling recommendations for the near term for this General Assembly session. They'll continue to meet, but I think Senator Deeds has made it quite clear on a number of occasions that he considers the most important legislation he has introduced a resolution that would create a joint subcommittee of the legislature to address these issues. And that means it will have continuity, and he said the General Assembly has to take ownership of this issue. It's not just a matter of gubernatorial orders. And I know that I have experienced the last time they did that with Senator Joe Gartland, no longer with us sadly, and Delegate Frank Hall led a joint subcommittee in the late 90s for 4 years that tried to redefine the roles of the CSBs to try to avoid this kind of disconnection that always seems to result in tragedy. So he thinks that's the most important legislation that he has introduced because he thinks it will be ongoing and will be able to address the larger issues that are not just about Gus Deeds, but other issues related to the behavioral health system in the state. So with that, that's my overview of where we are and where we're going. And I'd like to acknowledge several people in the audience who I think they've come at our invitation and serve as a resource for this conversation. Bonnie Neighbor is the executive director of VOCAL, which stands for Virginia Organization of Consumers Asserting Leadership. And this is about 1,700 people who have used the mental health system in this state. Also, next to her is Stephanie Melton Hardison. She's Director of Children and Youth Policy at the Virginia chapter of the National Alliance on Mental Illness. And she and her Executive Director, Mira Signer, are doing a lot of work at the General Assembly, as is Bonnie, to make sure their voices are heard in this debate. I know Bonnie's been very effective in, I think, reminding lawmakers about who this is really about. And then the third person is Farah Graham, who is the director of the Commonwealth Poll at VCU, and they have done some polling on this issue. And so I'll take it away, Tom, but you have these resources here in terms of speaking to the issues.
Sure. Thank you, Michael. Before you go on, because I know you have to, are you headed back to the General Assembly to cover something tonight?
A little later. I'm going to stay for a little while.
Okay. Let me ask you a question from your perspective. Why does this issue come back to the center of the community after a tragedy? I mean, you documented the history,
Well, that's the way of life always is. I mean, people move on. There's a short attention span, and the fact that this happened to the son of not only a state senator but a man who ran for governor in 2009. I think it personalizes it in a very powerful way, and I've had people accuse me of taking advantage of Gus Deeds. Well, that's nothing could be further from the truth. Certainly, Deeds does not want his son to be a poster child for mental illness or suicide, but he also doesn't want to let the opportunity pass to address serious problems in the way that behavioral health services are delivered in this state. So,
good, well done overview. Appreciate your coverage.
Thanks.
The topic is how do we improve mental health care in Virginia? This is not a debate like the two previous public squares. Raise your hand. Try to make one key point. Be respectful. Try to get it in within 3 minutes. And my job as moderator is try to weave together as many different comments as possible. If we've exhausted people who want to speak and people want a second shot at it, we'll do it there. So, any of our guests want to say something? Tip it off. No. Okay. Let the audience go first. Okay. All right. Thank you. Yes, sir. And the drill is, since you're first, here's the drill. Microphone next to lips. Identify who you are and say where you're from, and take it from there. And there is about a 2-second pause on the microphone. So we recommend any type of hemming beforehand. It's okay. So it kicks in.
Thank you, Tom. I'm Al Shallow from Midlothian, and I've got a couple items here that actually I had for the next session, but I think they're pertinent to any discussion on mental health care. A couple days ago, Dr. James McCulloch had an article, Add Community Prevention Strategy to Repair Virginia System, and he indicated that 50% of leading causes of death in the U.S. stem from lifestyle patterns. I think for the purpose of mental health, we ought to not only look into those patterns, but also to the part that legal and illegal drugs, hurtful and harmful, play in mental health. Their impact on society, physical and mental health, personal and corporate safety, prescription drug abuse, recreational use of substances, and find solutions to that part of it. I think we can probably help, at least according to this, maybe 50% of our problems with the mental health by looking at the root causes that cause people to have problems.
Okay. Thank you, Al, for starting it off. My colleague Floyd Spencer is on the other side of the room, so we'll tag team the room. Floyd.
Hello.
Hi.
Hi. I am Annie Holland, and I'm from Louisa County, and I am a certified pre-screener for a CSB.
What is a CSB?
Community Services Board.
Thank you.
I didn't want to identify it, but to answer the question, it takes everybody in this room to do that, and along with the state. But about maybe 8 or 9 years ago, when an evaluator pre-screened someone in crisis, and they were given a temporary detention order recommendation, hospitals took the person. It was a very easy process. Now, and over the last few years, hospitals decline TDO candidates, and that is ridiculous. Last night, I had an evaluation of a man, could not get him into Central State Hospital because he had not made an attempt on yesterday to take his life. He's an inmate, and the jail has a record. This particular jail has a record of many people committing suicide. If you want to take your life, you're going to find a way to do it. And the Commonwealth of Virginia, personally, from my perspective, being on the front line, I don't think it's the CSBs that are failing. It is the targeted hospital who will decline a very serious patient. If it's the weekend, they're understaffed, they will not take anybody because they're short-staffed. If there's agitation, if they're 6 feet and they only have 2 nurses, especially for a male, there are many, many, many issues. But the bottom line, what I see continue to see is who's going to pay for that person to stay in the hospital. It's all about the money and not providing services, very critical needed services. You can take away substance dependence, you can take away teenage suicide, but we're going to have those problems because we're human beings. And yes, we need services for drug dependence. And I mean, every week we have a teenager in the ER. Mom or dad took away cell phone or iPad or computer, or the boyfriend dumped her. She's overdosed. She's 13 years old every week. And we need to do a study on that because these kids are finding they don't have coping mechanisms in the families that live the different lifestyles today. And so we're citizens. We need to accommodate these kids. Beds need to be available for them, bottom line.
Good. Thanks for sharing that.
Thank you for listening.
May want to hook on to that or add to it? Go over here in the center, and then Floyd, you go next. Yes, sir.
My name is Bob Flax. I'm a mental health judge for Henrico County. The topic I would like to mention is once someone is in the hospital, if someone does not want to take their psychiatric medicine that would facilitate them restored to mental health, you have the right to have an involuntary order to take medicine. First you're asked, then you can be injected with the medication. And the experience of the Henrico County hospitals that will be handling these hearings is that they will not enforce, they will not even request a forced medication hearing. And the reason is something which is part of the next phase of mental health reform, which is that if someone who is mentally ill won't take the medication, the law allows you to contact their family members, their friends, someone who acts like a friend or guardian for the person, or then a committee of a competitive hospital system. There are certain levels of consent you would follow before you can have the forced medication hearing. The lawyers for the two health systems that would be involved take the position that by telling someone aside from the patient the need for a forced medication hearing as a violation of the federal HIPAA law, and so the state statute does not apply. Consequently, the person does not get the emergency medication to restore to mental health. And the insurance companies would then monitor that someone's stay at the hospital will say, well, he's getting no medical benefit from staying in the psychiatric facility, therefore the person should be released. And the hospitals will then release the person with no medication, and they're forbidden by law, I understand, to give the patient medication to take when they leave. The result is that someone who's psychiatrically unstable being restored with no treatment except being in a safe place for a few days, and someone will eventually die. And so this is the next stage of mental health reform issues. Thank you.
What motivated you to come today?
I'm just interested in the subject matter. I'm a mental health judge, and I used to represent patients in the mental health commitment hearings before I came here, before I became a mental health judge.
Appreciate your comments. I'll go to the next, working tag team, my buddy next, so you'll go next after him.
My name is Walt Pulliam. I'm from Henrico, and I was going to ask while Mr. Martz is still here, perhaps a contextual question, if I may. Some of these issues, forced medication, temporary detention, screening folks in jails, and that sort of thing are not new issues. Under Governor Gilmore, there was a significant commission that looked at mental health services. Under Governor Kane, there was a commission following the Virginia tax stuff. You spoke of Frank Hall's legislative subcommittees. All of those people address some of these issues. What's come of that? Has anything what's changed over the years, and how do we get where we are today, and then how do we move forward?
Want to handle it, or you want to throw it to your guest?
I'll take a shot at it. You want to? Well, I think they changed the law to make clear what the responsibilities are on each side of it. But I think what you find happens, again, attention is paid, money's put into the system, then attention wanes, money's taken out of the system. Like after Virginia Tech, they put $42 million into the system. Since then, 57 out. And because of the recession. So that's part of it. But I do think that there's a larger issue that you're touching on, which is it's just an accountability issue, and that the legislation that came out of the Gartland and Hall subcommittee was supposed to make that accountability clear. There's still a question about it, and I think the pre-screener made a great point. What's the accountability for the hospital? They're private hospitals. They don't have to take these patients, and that's when they talk about the calls. It's not just a matter of making a call. It's also documenting a person's medical condition, their psychiatric condition, and they have to get the hospital or the crisis stabilization unit to accept them, and they don't have to do it. So
this is a question that Michael might have asked you, so we'll have a shot at it.
Bonnie Neighbor with Vocal, the State Mental Health Consumer Network. Again, thank you for the opportunity. I think it's even a bigger issue than what we're talking about is in 2007, a lot of work was done with the Mental Health Law Reform Commission of 2007. A lot of studies, a lot of work, a lot of things were implemented, but basically just around the crisis response system. And again, here we are talking about the crisis response system. Nationally, if you look at the funding for mental health services, Virginia has a larger percentage of its state funds going into that crisis response in state hospitals than it does into community services that catch people before they're in crisis. I say by the time someone gets into a crisis, there's a huge failure that someone has even gotten to that point. So here we are again after another heartbreaking tragedy talking about how can we fix the crisis service and not really addressing what's in the community to help people. Getting them into an ECO or a TDO or an involuntary commitment where you may or may not be able to force them to take medication allows medication to get into that person, and that's it. What medication does sometimes is manage symptoms. It doesn't make somebody better. It manages symptoms for as long as somebody's standing over them and saying, take your medication. What we need more of is in the community, services that people want to go to. They have something going on in their life that's troubling them, causing them to struggle. I don't want someone to stand over my head and tell me what I need to do to stay healthy. I want a welcoming environment that provides services when I go, as opposed to a 6-week or a 6-month waiting list, which is where it is some places. So I think, although what got us in this room today was the story of Gus and Cree Deeds, and what got everyone else into the room, I wasn't here, in 2007 was what happened at Virginia Tech. We tend to only have these conversations after that kind of tragedy. I think the bigger tragedy is that we're talking about mental health and only crisis. We also need to keep in mind when we're talking about these particular stories, some statistics about the people we're talking about is statistically 1 in 4 people are diagnosable with a mental illness. And so I look around this room. I don't think 1 in 4 people in this room want to have an involuntary commitment. If they make a decision, other people don't agree with them, so let's get some services in place for those. Statistically, people that only have a mental health diagnosis are no more violent than anyone else. We hear the stories about violence because they're big and they're heartbreaking. With no other contributing factor, people with mental health issues are no more violent. So let's not talk about mental health and violence. Let's not use that statistic, spread that stigma, make people afraid to say, I need help, because they're afraid they'll be identified as potentially violent. Let's talk about mental health services and mental health recovery and services in the community.
Well done. Thank you. Anything I want to add? Sure. And then I'll go to this gentleman, the most patient.
Hi, everybody. I'm Stephanie with NAMI Virginia, and we are a nonprofit advocacy organization we represent families that have, we represent individuals that are affected by mental illness, both kids and adults, as well as their families. And I really appreciate the opportunity to be here. And I mean, there's not much you can top what Bonnie just said, but I mean, certainly what she said is exactly what we would, agree with and support and promote. I mean, I really just, the main thing to keep in mind is that it's really about a comprehensive approach. I mean, this legislative session, what's really striking about it is we're looking so much at the laws and so much at what needs to change. And if that, then, you know, if things need to be changed, then so be it. That's great. But at the same time, there's also laws that are probably doing just fine. And that really the ultimate issue that we have to keep in mind is the funding. Ultimately, at the end of the day, it's, you know, are the services in place that can help prevent those crises? It's really about a comprehensive, community-based approach. That's really what's needed. There's programs like PAC teams, for example, that can really help, that can meet people in the community and help prevent some of these ultimate crises down the road. There's crisis intervention programs. There was increased funding this past year about for those services, and there's additional funding being proposed for this year. Those kinds of things that can really meet people in the community and really help prevent any, hopefully prevent any potential tragedies. And you can really make the argument that crisis intervention, yes, it's really important and we need that kind of funding, but you can also make the argument that if you have all the other services in place, that's not as needed as much as some of the other things that can really support people in the long haul. I mean, really the tragedy with our system is that it takes a tragedy for kids to get help. It takes a tragedy for adults to get help. It shouldn't be that way. There should be something in between. So if you're just starting to have issues, if you're just starting to feel like you're a little out of control or you're feeling that there's something wrong, you should be able to get help right away. You should be able to go down to your community mental health center, your CSB here in Virginia, and you should be able to access services, period. But unfortunately, it doesn't really work that way. It does for some folks, but not everybody. And unfortunately, it often takes a tragedy or it takes a full-blown crisis. It takes a police intervention before somebody actually gets help. And that's what we really just have to think about. And again, it really, bottom line, it comes, you know, having these commitments, having these other programs, it should be a last resort. At the end of the day, we really have to think about what can we be doing in the meantime to really support people in our community and really make sure that they're getting the help that they need.
Thank you for that. Appreciate that. Yes, sir. You're welcome.
Yeah, this is Anil Kohli. I'm chemical engineer by training, and I worked for DuPont 36 years, and I just retired a couple of years ago. And it's a passionate subject for me, so that's the reason I was raising my hand here. First of all, if somebody is mentally ill, be assured that this is because of their DNA molecule. It's not because they took drugs. It's the other way around. They take drugs because they're mentally ill. And of course, there is various degrees of mental illness, small depression and schizophrenia and on and on and on. So, and that is part of life. That's how the life is. It has been there for human history. A certain percentage of people will have mental illness. Number two, when somebody is mentally ill, believe me, their families are suffering. And I noticed some of you made that point. It's not just one person who's suffering, it's the whole family suffering now. Okay? Now, what's the solution? It's not very complicated. First of all, if somebody is ill, they need to see a doctor. As you were mentioning, they should be able to call and see a doctor. That's it. I mean, if you trying to reduce a weight, you have to eat less. If you are ill, you got to see a doctor. I mean, what's so complicated about it? Now, of course, the problem is that not everybody has access to doctors. Okay? I mean, that's the way the system is right now. When somebody is mentally ill, they need to take medications, as Judge Fox said that. You got to take your medications. But keep in mind this talk about hospital and holding somebody for 12 hours. This is a periphery issue because that person is suffering all the time. And it's the family members who need to be educated and supported so that they can help that person all their life, literally. It's not a one-day thing. So what I would suggest, access to doctors so they can go and see a good psychiatrist or go to a hospital if they need, medications, and train the family members how to deal with these people. because there are going to be a lot of tough moments. And you read stories in the newspaper about the stories, tragedies occurring, shooting occurring, because, people, it's a momentarily thing. You just lose your being for a while. Now, I know, there's Affordable Health Care Act. I tell you, when I saw that required insurance companies to provide mental health, that's a positive thing. That's a very positive thing, that mental health should be part of all insurances. Now you can say, well, but there are not enough psychiatrists or doctors. Well, medical profession has to come up also with their plan, that you provide help, you make sure people are taking medications, and I would say provide help to family members, because in extreme cases, I can really see is some family member will have to quit their job and take care of the family members or reduce their hours. So that's all I want to mention, and some of you all made excellent points.
Okay,
Thanks.
good. Thank you very much. Appreciate it. Okay, Floyd, you go there, and I'll move up to the front.
How you doing? My name is Maurice Morgan, CEO of New Pathways Youth Services. We provide mental health services for adults and children here in the city. A few things that I see from being in business a while, as far as dealing with the communication. One thing that I see with psychiatrists, different hospitals, it's difficult to see where that prescription is going. You give your prescription to a patient, they go and fill it out. You don't know whether they're abusing it or not. 9 times out of 10, the next time you see them is when it's time to get the prescription filled again. What I would like to see is to close the gap. I'm a caseworker. There are a few hundred providers around the city. If psychiatrists link with caseworkers before somebody's released from a hospital, say Dee's son was linked with a caseworker that had to be linked to him before he even went home. That's somebody else extra, because a lot of times you said something about family. Families are burnt out a lot of times when it comes to dealing with people with mental illnesses. So a lot of times you may not get the support from family, but if they make it mandatory where psychiatrists link with caseworkers, so you'll know exactly where that prescription is going, where exactly is this person going after this. I've got patients that have left a psychiatric hospital here to be put in a cab with papers to tell them to go link up with this therapist or get this prescription filled. Now, with having a mental health issue, they may or may not follow up on the therapist. They may or may not have the means to pay for the medication. I have a lot of my clients that come to me where they don't have money for the medication. So what do you do in that case? Like I said, again, the communication needs to be brought together a lot better, because, when it comes to psychiatrists, they give the medication, but it's not a lot of therapy going on. You don't get to the bottom of the problem. I've set in appointments that are 10 minutes flat. They've got a prescription, and they're out of the door. And that's an issue for me. And I really feel like if the communication is brought together more between the psychiatrists, the caseworkers, the social workers, if everybody comes together and close the loop, then you won't have that many issues. Because you've got people also that abuse their medications. They may go to one psychiatrist this month, and they may go to somebody else, and they're taking medicines to get high and not really to subside their mental health issues. They're more likely, they want to get high now. A lot of these medications are on the streets for sale. Xanax, that's big on the streets in the drug market. So psychiatrists, doctors need to be more responsible about where these medications are going, and we need to be able to follow that person and not just you're out the door. For real, to leave a psych hospital, to be left, to be put in a cab, you don't even know where they're going. You just have an idea, well, you have an address, here's your ID. I've had one patient, if you would have seen the house that they were left to go to, there's no way that a doctor would have released them to go into this environment. So psychiatrists need to know what type of environment these people are going back in before they're even released. Just be a little more responsible. Just close the gap. I think if everybody communicates, when the discharge team call a caseworker, call me up. Hey, Mr. Morgan, we got a client here. They need a caseworker, to follow up with them for the aftercare after they leave out of here. See, nobody's really dealing with that part of it. You're dealing with, okay, they got stabilized, but you're going from this, you're going this intense for this week. Monday through Friday, you're at the psych hospital, and then you're released Saturday to what? Back to your room, back to your home where you get on your mom's nerves or your wife's nerves or your husband's nerves, and they really don't want to deal with you. So I really think if we close the gap and assign people to the people that are being released from these hospitals, I think we won't have that much of an issue.
Thanks. Appreciate it. Yeah. Welcome.
Hello, my name is Carol McDade, and I'm from Hanover County, and I'm on the board of the McShin Foundation and Focused Outreach Richmond, which is a nonprofit that deals with folks with psychiatric conditions who are criminal justice involved and need housing when they leave incarceration. And I think I've got two major points to make. Number one, to have the host of this forum, which we're delighted that you are willing to entertain this topic, have one of the most knowledgeable reporters in the state on this topic omit, when he gave an overview of mental health in Virginia, the epidemic and the crisis that's happening with addiction, which is a mental illness, and in fact, which is the most expensive untreated mental illness that we have. Says a lot about where we are in this community, about being willing to talk about an illness that is losing 10 people in Virginia a day. And just, grab hold of that figure. 10 people a day in Virginia are dying just from overdose deaths associated with heroin and opioids. 10 people a day. So that's not counting people like Gus Deeds. That's just from untreated certain types of addiction. And my second point is this, that we have a solution that's on the books. A federal law was passed in 2008 called the Mental Health Parity and Addiction Equity Act. Many of the people in the room have fought for 17 years to get this law passed. It requires health insurance companies and self-insured employers to treat mental health and addiction like they do any other medical condition that's covered by health insurance. And what that means is, if you show up at a psych ward or you show up at an emergency room and you're told that you have to be homicidal or suicidal before you can get care for addiction, you're breaking the law in the state of Virginia, and the Department of Insurance needs to issue regulations or a bulletin or guidance that says that. They have the ability to levy fines against plans who commit these violations, $100 per member per day fine, and this state needs to enforce those laws. The private sector is shirking its responsibility for treating mentally ill people. We pay premiums for our insurance. Mental health and addiction services are part of that coverage. We now have a federal law that says that coverage must be available to people on par with the coverage for other medical conditions. And shame on us if we don't enforce that law that is on the books, that is ready and able to get people coverage today. Thank you.
Okay, thank you. Yes.
Just real quick, as we continue this conversation, I've heard a lot of references to the people with mental health and the people who will never get better and their family members, and I want to introduce you to somebody who has a mental health condition, and that would be me. I have 6 of those diagnoses. Two of them fall into the serious mental health, that's 1 in 17, that often ends up being the person living on the street, and in fact, I was living in my car for a certain period of time, and I've been hospitalized for mental health issues. And I'm one of the lucky ones who, when I went for treatment, treatment was available. And when I said, I refuse to take that specific medication because I don't like the immediate side effects of it, my doctor said, let's work and find something else. And when I was given a second medication and I said, I refuse to take that one because my peers, other mental health consumers, are dying 25 years younger because of the metabolic disorders that are caused by this particular medication, my doctor said, fine, let's work with something else that'll work for you. Nobody came in and told me what I had to take, so I didn't have to refuse to take it. It's not that I don't know that I had an issue I needed help with. It's that I wasn't happy with the offer that was being given with me, and someone was able to help me work with that and find something else. So as we're talking about those mental health people who are a burden to their family or who may be sick for the rest of their life, that's not true. I've gone from living in my car to being an executive director of a statewide program. I've provided housing for someone else for 18 months. I provided housing for a family for a couple of months after that. Oh my gosh. And I want us to remember we're not just talking about Bonnie. We're not just talking about those people who are ill. They're Virginia citizens who also need access to services and need us to remember that they're not their illness, they're Virginia citizens, and they have a lot to offer. How can we provide those services in the community before it's a crisis time? Thank you.
Okay, thank you. Yeah.
My name is Serena Fazildin, and after working as a waitress, I had a difficult time finding a job. So a friend of mine told me, oh, the correction department is looking for substitute teacher. Why don't you apply there? I said, wow, great, okay. So I applied there not knowing what I'm going to do or I didn't have any experience with the juvenile boys. So that was with the Department of Correction Education, and I started teaching there. And while I was teaching, I was able to receive my special education certification. That means I had to teach the learning disabled and emotionally disturbed children. And as you said, what the service they need to receive. From my experience over there for 7 years, I don't think so those children should have been there. Most of them were very talented boys. They just got in trouble in doing drugs. And while they were there, all they received was medication all day long. And there was no therapy service. And these children came from, majority of them came from the low-income family. So they did not have the support of the family from beginning. They did not have the support from the children in school, from the teachers in school. So they did get in trouble, and while they're in trouble, they came to the correction, and there was not much support or therapy for them there. So I'm sitting here puzzled, thinking about those children that I taught, and I read about them with the Richmond Times-Dispatch. Often they kill so-and-so person or they kill themselves, and trying to think what we can do or what service they need. All I did is taught them, and most of them did very, very well, and some of them passed the SOL the highest. So it's for us to think what service, but the service need to start from the beginning, from the family, from the teachers. We can't just throw them in the juvenile facility and give them drugs, and hopefully they'll come out after 1 year service, they will be treated. But now they are out there, and they haven't been treated, and they are 18 years old, so they are on their own. No one is there to tell them, hey, take your medication. So we need to provide them the service that they needed from the beginning, especially those who are coming from low-income family where the support is very less here.
Thank you. Appreciate it. Sure.
Yeah, I mean, it's everything we're talking about really, honestly, boils down to the lack of services, period, especially with kids. I work with families all the time. I mean, that's who I represent, are the kids that have mental health needs in their families. And unfortunately, it's a revolving door, and families are really having to go through a lot. I mean, the system, let's face it, it's broken. And unfortunately, again, it takes a crisis before these kids get help. And it's unfortunate that the juvenile justice system oftentimes becomes a de facto mental health system for our kids. Or oftentimes you hear stories about parents being told, oh, if you give up custody of your child, then, that we can get them services. That's no problem. We can get them help. I mean, can you imagine? Can you imagine being in that situation? Say your child had diabetes, or say your child had cancer. Can you imagine a professional telling you, oh, if your child is in the child welfare system, if you give up custody of your child, then we can get them help? What Bonnie's touching on, this is a human face. These are people. The reality is 1 in 4 families are affected by mental illness. I mean, think about that. I mean, really, the majority, if there's so many times where you say, oh, I'm a family member, every time that happens, I swear, somebody comes up to say, oh, I am too. And there are so many people affected by this, and it's really, again, it's that human face, and that really, ultimately, at the end of the day, it's about treating people the way they should be treated. And the reality is that we have to work together to do that, and it takes all of us making that commitment to make sure that our system works for our families and our individuals.
Okay. We've got about 10 minutes left. I'll go over in the corner over here, Floyd.
Hi. Good afternoon. My name is Wes Suit, and I'm with Focused Outreach Richmond. And appreciate you guys having us out here and the comments made before. Focused Outreach Richmond, we provide services to individuals coming out of jail who have mental illness. And really appreciated what's been said around community-based services and the comments that the gentleman made about the communication between whether it's a psychiatrist or whether it's the jail, because we really see that that's where the large disconnect is that whoever's providing the service is that the communication and connecting them to the supportive services when they come out of jail, we're just not really seeing it happen. Just to give you an example, a lot of the, we happen to work with males right now, and a lot of the males coming out of jail who have severe mental illness, they come out, they have no benefits connected to them, they have no financial resources. And if any of you all have tried to schedule a psychiatric appointment for someone who doesn't have any money or any insurance, you've experienced some of the challenges that these guys are faced with. And most of these people have trouble scheduling their own appointments. So as case management, we try to connect them, and we run into a lot of barriers. So that's one issue, making sure that people coming out of jail do have benefits, whether it be some type of state benefit or some type of resource in the community. And then, some of the other challenges is that when they get out, they're being either supervised or the mental health services are being provided by institutions that are overburdened. I mean, we've heard it talked about, we've heard it that it's a financial issue, and it was mentioned earlier that it does take multiple organizations to provide, wraparound services. So we don't think that it's any one fault of any one entity, but there's definitely a disconnect in providing the services for people coming out of jail, specifically those that have mental illness. And I just want to leave you guys with a story that we think kind of sums it up about the state of mental health services for people coming out of jail. We just had a client released to us, and when he came to us, he had a bag of medications. And in the bag of medications, there was medications that had someone else's name on it, and they had medications that had handwritten instructions on dosage. So, and this gentleman was released to us straight from jail. So it wasn't like he got these on the street or someone, wrote in something. So this is the state when they're coming out. So we just wanted to make a couple of those points, and that's all I have.
Thanks a lot. Appreciate it. Sir.
My name is Jason Buckley, and I'm a person in recovery. I just want to touch base on the fact that our system is broken. The money that feeds the criminal justice system and the prisons and those who supply the prisons and everything involved with incarceration for folks like myself who has had a substance abuse problem since I was long enough to remember. I was born with it. It's genetic, and it's a disease. It should be treated as a disease. We need to get some of this money funneled to the RCOs, the recovery community organizations. Like Carol said, folks, 10 people are dying a day. I mean, we have to put our assets in the right directions. We have to be a voice for recovery. I was released from jail, and I was only released with a pair of shorts and a short sleeve shirt on a 17-degree day with nowhere to go. And had it not been for a recovery community organization, I wouldn't have had anywhere to go, and I would have been right back in the streets doing the same thing that I was doing. I don't know. I can't stress it enough, how far and how bad our system is broken. Just with the financial resources going where they're going and where they could be. And this, we could eliminate so many of these problems. We could cut down on the population of the jails and prisons. And, so much money could be saved to the states and the federal level. So much money could be saved by putting this money into the RCOs and to the recovery community organizations. It would save billions of dollars. But then, if you did that, all those that are making money on the prisons and the jails and the lawyers and everyone else, of course their pockets would be depleted. And I guess that's really the issue. I'll leave you with that.
Thank you. trying to get, she has not spoken, you have, but, okay.
Thank you. I just wanted to provide a data point going back to some things that Stephanie was saying. It's about crisis, and so it's hard for us to kind of reconcile the stop and go kind of attention that gets paid to mental health, but I wanted to give you a data point from the polling that we did statewide last month about people's willingness to pay for a variety of services. We asked Virginia citizens about their willingness to pay more in taxes to keep certain government services going at their current level. And we've been asking this question for a number of years, since 2008. And an interesting thing's been happening with mental health services, and that is over time, since 2010, the willingness to pay has increased by 10%. So I think people are starting to recognize the fact that mental health services is an important issue. It is equal to or has come in actually above as number one last year. So 70% of people are willing to pay more in taxes in order to keep our mental health services systems going. I think that says something to the fact that we are becoming more aware of it as an issue, and a majority of Virginians also were quite willing to say that mental health services receive too little funding. So we do have an understanding that the system itself isn't funded properly, and people are willing to pay to try to get that funding. So I just wanted to offer that as a hopefully a point of positive benefit, and hopefully we can work towards having that feed through to the General Assembly as well.
Thank you for that. Appreciate that. Boyd? George?
My name is George, and I've got some issues. I came back from Vietnam 50 years ago, and for 40 years, I tell people right now I'm refired. I've been fired for the last time, and I had mental issues, and for 40 years I didn't know it was my problem. It was always those incompetent, stupid bosses I had to work for that I didn't deal with well, and so it was one job after another, and my career went from here to here to here to here to here, and now I'm here. But the concern that I have is if you think the mental health system is strained now, wait till these guys all come back from Afghanistan that have been there 6 and 7 times. You know, I say I left Vietnam, but Vietnam never left me. These guys are going to have some major issues. And right now when they get out, they're warriors. They don't tell their supervisors or their bosses that they got nightmares at night and they got flashbacks, because they're warriors. That's sort of a cowardly thing if you have nightmares and flashbacks. But they're going to get home in 5 years from now. They're going to see a Walmart bag floating down the median, and they're going to go home and kick the dog and yell at the wife, and nobody's going to know what's going on. And the system's going to be overloaded. And I know the VA system here at McGuire is fantastic. They've done so much for me, but they're not prepared for what's ready to happen.
So what would you recommend for an improvement?
Greater services. I mean, the school their wives and their husbands that, you know, when they start acting goofy, you know, I can't sit with my back to a restaurant. I go to a restaurant and they say, in the old days, they say smoking or non-smoking. I'd say in the back so I can sit and see everything that goes on. And then when I'd order my Pepsi and my menu, I'd go to the bathroom and my wife thought I was washing my hands. I was checking for a window, how to get out if there was a case of a problem. And if someone should sit, so I have to sit with my back to the restaurant, I can't sit down. I just can't sit in the seat. You know, and I know the door is right behind me, and I feel uneasy about that. I'd rather be sitting over there looking out here. But it's going to take a lot more services, and we've got to recognize it before our Congress and our representatives are ready to allocate the money. You know, and that's what it's going to take.
Appreciate
Thank
your comments. We're almost done. We're actually past the 1 hour mark. Okay, John, here's the mic.
You know it's quitting time when he gives me the mic. How many of y'all here because of substance use disorders or a family member or somebody? That's how critical mental health is. And our own mental health people, they don't even know it. The paper don't know it, okay? And a lot of y'all never heard of NAMI or Vocal till you just heard it today, who they are. And that's what that commission's doing that the governor's convened. A bunch of bureaucrats are getting together doing a kabuki dance, okay? And they're going to make sure we stay disenfranchised from one another. This is what's taking place. As long as we leave bureaucrats in charge of our future and our destiny, we're going to get what we've been getting for 25 years. All our funding goes to the criminal justice system. $7 billion a year goes to substance use disorders, the consequences. Less than $20 million goes to substance use disorders recovery, and we're letting it happen. I've been reading the paper since I was 6 years old. I'm 55. One committee, one commission, one study after nothing, and nothing happens. We have a solution, but it's not a bureaucrat solution. As long as we keep bureaucrats in charge and in power for these solutions, they're never going to come. And as long as we let these policymakers put these bureaucrats in charge, change will never happen. We are the problem, ladies and gentlemen. Therefore, we must be the solution. We in recovery know the solution for addiction is recovery. It's best delivered by recovering people in a recovery environment. Community, trigger word, hello. And I'm crazy too. I'm just untreated. They don't make a drug for me. So I am at home. But until we stand together and do what is right on a regular basis, change ain't happening. Our biggest problem right now is bureaucrats and policymakers. They don't have a clue what the solution is for either addiction or mental illness. And throwing money at a problem, you nuts. All they're going to do is spend it on something other than services. Dollars, tax dollars spent through our agencies do not equal recovery. They equal overhead, buildings, security guards. They don't equal recovery. Come on, get with it, folks. You're educated. And I hope your newspaper picks up on this because Carol was right. Michael missed a real important part about
Pick on
this.
Michael. He's not here.
I know. Well, he can watch the video, can't he? But anyways, listen to me. It's the biggest problem is the bureaucrat. They don't know nothing. They're just kabuki dancers, period.
Okay.
Thank you.
Well, John, we always look for somebody to have the last word. That's about as good as the last word we can get. We're past the hour. But I'm going to do one other thing. There was a fairly regular contributor to the public square. His name was Cliff Troutman. We read in our paper. He passed away in a house fire recently. I like to end the public square at a moment of silence in his honor. He was a Vietnam vet. He talked quite frankly about his problems. This is a topic he would have been here. He probably would have shared. So end, if you will, on a moment of silence in his honor. Thank you. Cliff, you had the last word on this public square. Thanks very much for a somber conversation, but a pointful conversation. And I hope that our coverage does help those making policy make important changes.